Chapter 1, Video 2. Now we're going to talk about the crossover skills. So we discussed cross-training and people being cross-trained to perform skills. Some of these skills that people can be cross-trained on, and they are considered crossover skills, and that would be collecting a blood sample, performing an EKG, observing cardiac monitors, and transporting patients. So this is just a list of some different skills that a person can be cross-trained to perform. The nursing assistant may be referred to as different titles. You may hear them referred to as nursing assistants, UAPs, which is unlicensed assistive personnel. A UAP is not required to obtain a license to work in their setting. They work under the direction of a licensed personnel. Okay, so with a UAP, that is an unlicensed assistive personnel. They do not have to carry a license, but they do have to work directly under a person that does carry a license. Healthcare assistants, HCAs, that is considered HCAs. A patient care assistant is a PCA, or a patient care technician is a PCT. So these different nursing assistants may go by different titles. What do the initials UAP represent? That would be unlicensed assistive personnel. Again, unlicensed assistive personnel are healthcare workers who are not required to obtain a license to practice their profession, such as a nursing assistant who works under the direction of a licensed professional nurse. Now, we're going to move forward. We're going to talk about advanced care skills. There are different skills that are performed on patients that are considered advanced, and we're going to talk about that. Inserting and removing a Foley catheter. This is one thing that you guys will learn how to do in lab, is insert and remove a urinary catheter. And the reason this is an advanced skill is because it has to be sterile. So with a sterile field is created on a hard surface, and you're basically creating this microbe-free work area. And because this removing a urinary catheter has to be performed sterilely, then, it's important to know that, because it is a sterile field, when we perform inserting and removing a urinary catheter has to be sterile, this makes it an advanced skill. Changing a sterile dressing, again, we don't want any microbes to hit that area, so it's a sterile procedure. So sterile procedures are advanced. Caring for a tracheostomy, this again is a sterile procedure. So this is an advanced care skill. Suctioning, that's pretty risky when we start suctioning a patient and their airways clogged up. So that's one thing that we look at as an advanced care skill, because we have to unplug that airway sometimes and get that patient back breathing. Discontinuing an intravenous fluids is an advanced care skill. Anytime we're dealing with an open wound and performing wound care, that open wound is a portal of entry for infection. So we have to be really, really careful when we're performing wound care, because we don't want microbes and endospores to enter that wound and cause an infection. So that would be considered an advanced care skill. Now we're going to talk about your job description, the importance of a job description. With a job description, everybody should have a job description. It's going to list the skills and tasks that you are responsible for knowing how to do. So when you take a job, you need to make sure that you request to look at your job description so you can see exactly what you are and are not to be doing. The skills that you are expected to do might differ from one unit to the other in the same facility. So, if you're transferred to a different unit, you may have a different skill. Your job description may slightly change. So again, you want to make sure that you read that description. You may be expected to learn more skills. If you get into the workforce and again, you don't feel like you're trained to perform something, but because of the lack and the shortage of nurses and healthcare professionals, you may have to be trained to do something. That would be listed in your job description again. But once you become trained and you go through the proper channels, that's part of your job description. But if you're ever put in the position where you don't feel comfortable performing a skill, you need to always let the nurse or the doctor know. And not to say that you're going to reject doing it, that you don't want to learn it, but just explain to them, it's going to take me longer to learn the skill than I had anticipated. I need more practice. I need more assistance with this until you feel comfortable doing it independently. Again, if you ever have a question regarding performance of a skill, you can ask your supervisor or you can look in the job description. One of the responsibilities is acting professionally. This is a list of different responsibilities that you as a healthcare worker are required to act on. You need to always act professionally. Make sure that you are thoroughly trained and comfortable in the advanced skills listed in your job description. Always ask for assistance when needed. Any changes that you may observe regarding a patient or a person's condition, you need to report that immediately. You need to be available to assist the nurse with any skills that she may need assistance with. Continuing education is necessary. The healthcare is ever more growing and changing. So continuing your education, keeping up with the latest and greatest changes is very important. Always ask questions, read nursing journals, take advantage of your in-service education that's offered by your faculty or facility. You want to stay motivated and keep learning. Tell whether the following statement is true or false. One way to keep up to date on skills is to attend an in-service education at your facility. So in this situation, the answer would be true. It is important to keep up to date on developments in your field, and the best and most economical way is to take advantage of in-services at the workplace. Now we're going to talk about quality control measures. Quality control measures is U.S. government regulations set into place to protect the community health by ensuring that healthcare workers are properly trained, that they meet the standards of cleanliness and quality, making sure that healthcare is available to everyone, and independent organizations exist to help ensure that facilities provide quality health care. The Joint Commission was established in 1951. The Joint Commission was formerly known as JCAHO, JCAHO, the Joint Commission on Accreditation of Healthcare Organizations. So you may hear the term Joint Commission. Again, formerly this was known as JCAHO, and we've seen them a lot in the hospitals, so don't get those confused. But I need you guys to read up on the Joint Commission and understand, again, what they do. You're going to be asked questions on your certifications for phlebotomy and patient care tech, an EKG regarding our accreditation agency. So you need to read those in depth and understand those. The Joint Commission, these are healthcare people. Healthcare people like the Joint Commission, they seek this accreditation because it's recognized nationwide and it's a symbol of high quality care. So a lot of facilities seek this Joint Commission accreditation because that just looks so good on them, because it sets the bar high. They set the bar high for facilities and standards. The Joint Commission standards regard safe medication administration, infection control, use of restraints, abbreviations, documentation, staffing, education, how they respond to emergencies. The Joint Commission's gold seal of approval is displayed by accredited healthcare organizations, and it is recognized nationwide as a symbol of quality. So make sure that, know that the Joint Commission, that is high quality care. So being accredited by the Joint Commission is definitely a plus. And that will be the end of Chapter 1, Lecture 2. If you have questions, please let me know.